I'm Paul Sponseller. I'm a pediatric orthopedic surgeon at Johns Hopkins in Baltimore. Halo traction is a measure used for kids with severe curves so that it can help to correct the curve gradually and use time as another force to provide safe correction. Gravity traction is used only for a select number of children who have curves that are rather big, and we need to stretch out the soft tissues and do everything gradually and safely. It also allows for a period of nutrition and accommodation to the new shape. It allows the skin and muscles to stretch out in a way that a one-stage surgery wouldn't effectively do, so you can get a better and safer correction of some of those more significant curves. Halo traction works by using the forces of time and gravity to help aid in the correction as a precursor to eventual surgery. Sometimes it's used as a precursor to bracing, but most often a precursor to surgery. And the upward pull of weights on the halo against the downward pull of gravity allow the spine to gradually stretch out a little bit more every day, and the muscles to stretch out, and the ligaments to stretch out, and the spinal cord and nerve elements to stretch out and accommodate and develop more blood supply, so that everything can be done gradually and safely and slowly, again in a way that a one-stage procedure at the time of surgery couldn't do. Nothing is completely free of risk, but halo gravity is pretty safe. The fact that it's done slowly and the child can be monitored and watched allows it to be done at a rate that's appropriate for each child. The risks are very small, but there could be a risk of inflammation at the sites of the halo pins. That can typically be treated with antibiotics, and it rarely becomes anything significant. It's more of a temporary thing. There can be some stretch on nerves to the eyes and to the tongue, which again can be relieved or released or reversed by lessening the traction temporarily. There can be some skin problems if the person has a bony prominence that needs to be attended to and padded. But by and large, it's pretty safe, and the number of kids who have complications is less than 5%, I would say. Yes, that is the main purpose of gravity traction. The upward pull of the weights and the downward pull of gravity will gradually straighten out the spine and also the skin over it and the muscles next to it and the ligaments holding it together and the nerve roots inside, so everything gets straighter and it actually can grow and stretch out. It can adapt over the time. The reason halo traction takes time is because it gives all the tissues a chance to grow and heal and stretch out in a way that couldn't be done at one stage. So are there any complications from having halo traction? There can be a risk of inflammation or infection around the pin sites, a risk of pressure sores on the skin, a risk of stretch to the nerves going to the eyes and the tongue and other nerves. Those are usually reversible by either antibiotics, reversing the traction, lessening the weight, and it's rare that you have a permanent complication. The length of the traction is individualized. Your surgeon or your physician will help to guide you in how long it should be. Usually it's a minimum of 1 to 2 weeks, can be up to 1 to 2 months, and in some cases even longer. It depends on whether the aims include improving your nutrition, how bad the curve is, whether the lungs need more time to get better as the curve straightens, and just how severe everything is. So your physician will give you a guidance on that, and it's a range, but it usually, again, because time is a factor in the correction, you need the time. You can't do it all in one day as a typical surgery would be done. Halo gravity traction is surprisingly comfortable. The pins are inserted under anesthesia, but once they're on, the children typically do not complain of pain. They may need to get psychologically adjusted to the way they have to be in the traction, but it's not typically a complaint of pain. And so once it's time to sleep, there's typically no difficulty getting to sleep. They sleep in bed, and the angle of the traction is lowered to match the angle at which they want to sleep, either flat or slightly elevated. And they are free to turn in one position or another, so they sleep on their back, their side, or even on their stomach, according to how they prefer.